one of the questions that I get asked a lot when people first come in to see me for something to make themselves look younger, you know, something like Botox or fillers, is, am I going to look, will people know that I've had this done? Am I going to look false? Is my forehead going to be frozen? Are my lips going to look really swollen? And it's really understandable actually that people think like that, because the only advert for Botox or fillers is the bad adverts. It's those celebrities that have probably had a bit too much Botox, the celebrities with the trout pout, with that, people who have that done look. So it's really, really understandable that people ask that question. I always say to them that it's not my goal at all to make them look like they've had something done. What the look that I like to achieve is a really natural, refreshed, perhaps slightly younger look, but definitely not that done look. I always, when clients come in, I say, take a look at the people who come in and out of my room, take a look at the reception staff, take a look at myself. These are the adverts for the kind of work that I do. I definitely, don't want to give you, do a procedure on you that people are going to say, oh my God, have you seen her? Look what she's had done. That's definitely not the aim. When we do our training, we're trained to look at the face, aesthetically. So we're trained to look at the areas that might make you look a little bit older or might make you look a little bit tired, and treat those areas. I think sometimes what happens is people get really focused on one area, and they I don't like this line, and I don't like this. And what can happen is sometimes, those areas are over-treated and can give you quite an awkward look. It's just really important to have a look at the whole face, and to treat certain areas that will, that will make you look younger and refreshed. And that's really what I say to people.